All right, I think we are ready. Good afternoon, everyone, and thank y'all so much for participating again. If this is your second or third or fourth time with our series for this year's Developmental Screening Webinar Series, my name is Dr. Teresa Northington, and I'm the Developmental Screening Coordinator for the Bureau of Family Health. And it is with great pleasure that I get to introduce today's webinar, which is entitled Empowering Growth, Advancing Developmental Promotion and Statewide Resources. Please note that this webinar is being recorded. I would also like to remind you that if you are participating today and you are a social worker, a nurse or nurse practitioner, or a physician, and you would like to receive CE or CME contact or credit hours for attending this session, please be advised that you must attend the full session and complete the evaluation that will pop up at the end of the webinar. Before we begin, I will read a quick disclosure statement. Julie Emery and Lenore Robinson have disclosed that they have no relevant financial relationships. All remaining faculty, Louisiana AAP, Education Committee members, and staff have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. All relevant financial relationships have been mitigated. So now to introduce today's speakers are Dr. Lenore Robinson and Julie Emery. Dr. Robinson is the manager for the Family Resource Center with the Bureau of Family Health, and Julie is the medical home coordinator, and she is also the Learn the Signs Act Early Louisiana ambassador. Both speakers bring a wealth of knowledge about Louisiana's supports and resources for families, and we are very excited to hear about all the information that they have for us today. So I'm going to turn it over to both of y'all.
Thank you, Teresa. Let's get my slides up. All right, good. Presentation mode. All right. I'm not hearing a stoppage, so I think we're good. Okay. Good afternoon, everyone, and welcome to the webinar today titled Empowering Growth, Advancing Developmental Promotion and Statewide Resources. Like Teresa said, my name is Julie Emery, and I am the Pediatric Medical Home Coordinator for the Bureau of Family Health, Office of Public Health, Louisiana Department of Health. And in that role, oh, yes, Teresa.
You need to put it in. I see the slides, but I also see the ones on the side.
You also see the ones on the slide. So, okay, one moment. That better? That's good. Okay. So, as I was saying, in that role, I support practicing and in training healthcare providers on various components of the medical home model, one of which we will talk about today. And I'm excited to be here with my colleague, Dr. Lenora Robinson, who will introduce herself a little bit later in the presentation. So this informative webinar will dive into critical components of developmental promotion with a special focus on understanding how to access and utilize various state resources. We're going to be discussing the medical home, the difference between monitoring and screening, and highlight multiple supportive resources that are available to individuals, families, organizations, to support optimal growth and development. Let's start with the medical home. The medical home as a term may or may not be familiar to you, but it is a patient and family-centered approach to providing comprehensive, coordinated primary care. It is a team-based healthcare delivery model organized across all elements of the broader healthcare system and includes active collaboration between families, primary care providers, clinical specialists, behavioral health providers, hospitals, and community programs. The concept was originally introduced in 1967 as a central location of a child's medical records. But in 1992, the American Academy of Pediatrics published a statement defining the medical home as a recommended care model that was accessible, family-centered, continuous, comprehensive, coordinated, compassionate, and culturally effective. It was later updated in 2002, and then in 2010, the Patient Protection and Affordable Care Act was signed into law by President Obama, emphasizing the implementation and promotion of the medical home model for children and adults. It has become a widely accepted model and it's considered the gold standard of how pediatric primary care should be organized and delivered throughout the healthcare system. It is not a physical location, but rather that model for providing patients and their families with comprehensive care. And developmental monitoring is a key element of the model because it allows multiple touch points for these components, and it will be our major focus today. So let's take a moment to review the demographics of children and families in Louisiana. By understanding the unique needs of our children, we can better identify risk and understand the importance of comprehensive medical home services and support. You may quickly notice that children in Louisiana are elevated in each area compared to children across the United States. 1 in 4 children in Louisiana have a special health care need compared to 1 in 5 in the US. 28% of our children have been reported as having a mental, emotional, developmental behavior concerns. And then 5% have been diagnosed with autism disorder. And we do expect that to rise as we increase the screening and the access to screening. And then in addition, 25% of our families with young children are living in poverty, which we know influences the risk for many other challenges. As I mentioned, under the medical home umbrella is both developmental monitoring and screening. Louisiana has worked to increase the rates of universal developmental screening in Louisiana since 2015, and we are proud to report that we are currently performing above the national average according to the National Survey of Child Health, and we hope and plan to continue increasing those rates. So today we want to look at developmental monitoring and how we engage the families that we serve to not only understand and value developmental milestone, but also partner with us to monitor their child's growth and development. Across the healthcare provider community, there's a noted disconnect around developmental services. Provider surveys have indicated that there's a lot of screening going on at every visit. However, sometimes what is meant is that provider is doing high quality surveillance. Developmental questions embedded within an EMR or EHR to promote developmental discussions during well child visits. They're also surveillance, but they're not necessarily screening. Screening is using a validated screening tool with fidelity, which means using the entire tool. And the tool provides scores or categories of risk that may be used to qualify for early intervention services. Surveillance or monitoring should be used consistently throughout the first few years of life. So not just specific time frames like screening is recommended. And surveillance and monitoring do not have associated scores. So they're going to look more like that checklist framework. So we'll see here on the screen, which is our Louisiana developmental screening guidelines. Different than screening, ongoing developmental monitoring of young children is an important component of preventative care services, and it is continuous and fully engages the family. So when you look at this chart on your screen, you'll see the orange boxes that are indicated or indicators of the recommended ages for screening. The grayish blue boxes, depending on your screen, that is the recommended time for surveillance and monitoring activities that match the recommended well child visits. These well child visits during these intervals provide the opportunity to engage families in developmental monitoring and really support that partnership. Again, engaging families in developmental monitoring is crucial to supporting positive health outcomes and connecting families to resources when they are needed. In a survey in 2008 conducted by 0 to 3, 70% of parents reported that they Google, they look for information regarding developmental milestones. This was the highest reported child rearing topic from the survey. So this exceeded reports of looking at information about behavior or looking at information on school success. That developmental milestones was the highest reported piece that parents were looking for. So this tells us that caregivers are interested in those partnerships and they're primed and ready for those partnerships and conversations regarding developmental milestones. So we know that the monitoring surveillance needs to be a partnership. So I want to now introduce you to a tool that supports that partnership with evidence-based resources. The Center for Disease Control and Prevention Learn the Signs Act Early initiative aims to improve early identification of developmental delays and disabilities by promoting developmental monitoring and screening so that children and families can get the services and support they need using this free research-based, parent-friendly resources on child development that also helps to boost family engagement as well as your own professional development by learning the signs of healthy development and acting early if needed. The Learn the Signs Act Early is a health communication tool that's evidence informed, and it includes milestones that children in the 75 percentile achieve by the given ages. Utilizing that 75 percentile avoids that wait and see approach and encourages screening as the next step so that we can connect to early intervention as early as possible if needed. If you are familiar with these tools or you have used Learn the Signs Act Early in the past, about 3 years ago, they were updated utilizing the 75 percentile. Prior to that, it was a 50th percentile. So what we were finding there is that gave more of the wait and see. If only 50% of kiddos are reaching this milestone at the age, then maybe we wait a little bit longer, which is really delaying that next step of screening, that next step of maybe referring to early intervention. So by using the 75 percentile, then we know if we see any red flags, if there's several milestones missing, then we definitely need to go further with that next step for screening or evaluation. So the first specific tool I want to talk about is the milestones checklist. They are available at all of the age intervals that match recommended well child visit. They, of course, include milestones in different domains, but they also include guidance of what to do when there is a developmental concern, reminders about well child visits and developmental screening ages, anticipatory guidance on what to expect at the next age, and tips and activities for developmental promotion and early relational help. These checklists are available to download on the CDC Learn the Signs Act Early website, and they are written in a family-friendly language at about between the 5th and 7th grade reading level. And they also, the milestones that are listed are observed in natural settings, and they are available in 17 languages, and they're free and accessible. So if you look at the checklist, you will notice that the milestones are divided into 4 domains. The first domain is social emotional development. And a lot of times caregivers don't connect this as a developmental growth or understand the caregiver's influence on social emotional milestones. They may ask you questions or have concerns about behavior instead of labeling that as social emotional growth or milestones. And this is really a great opportunity to connect with how that behavior is parallel with those milestones. Reaching optimal social emotional health means that we have the ability to create and sustain meaningful relationships, and caregivers can encourage that by providing a nurturing environment for growth. The next domain is language and communication. And when we think about that domain, most caregivers are counting words that their child is saying, or they're acknowledging that that child understands directions. And while these things are certainly important and crucial milestones, understanding the bigger picture of the language and communication domain can be helpful, especially when we are in the case that we need to encourage families to connect with early intervention. Because milestones are building blocks and they build on top of each other, when one is delayed, in a lot of cases, milestones that follow are also delayed. And so as children enter the school system, and they have a language delay, it could spill into difficulty with peer interactions, or even their academic studies. So that often helps in promoting that monitoring of those milestones. Then we have cognitive development. And cognitive is certainly not a term that many of our caregivers are familiar with. So a lot of times we need to explain that cognitive refers to the learning, thinking, and problem solving piece of development. Sometimes cognitive delays may be presented from caregivers as behaviors and frustrating behaviors, but those behaviors may be happening because of the child's frustration with maybe problem solving or completing a simple task. And so we want to make sure to, again, check those milestones and make sure that they're hitting those at the appropriate ages. Sometimes cognitive concerns or delays may not emerge until school entry, which means that we have missed those early intervention opportunities. So this really gives us a solid case of why monitoring developmental milestones early is so important, so that we don't miss those milestones to connect with intervention early. And then finally, physical development. Other than words spoken, crawling, pulling up, and walking are usually very popular milestones that caregivers are familiar with. But some additional components of physical development that I like to point out to caregivers is that feeling of accomplishment and confidence that is attached to those physical milestones. And so there are many activities listed on the checklist that can support this specific domains and give caregivers some ideas of what they can do. So we also, several years ago, we BFH partner with the Louisiana Department of Education to customize the checklist with parish-specific phone numbers for early intervention services. So you can go to this website or scan the QR code and click on your parish, and it will read just like the milestone checklist that's from the CDC website, but it includes phone numbers for the local early steps office. So if early intervention is needed before the age of 3, as well as the local school system if early intervention is needed above the age of 3. We can also customize these checklists for your clinic or your organization, put your logo on it. If that's something that you're interested in, you can email me, which will have my email at the in the last slide. So now let's look at the Milestone Tracker app. It includes the same content as the Milestones checklist. It is available in English and Spanish. It is available for iOS and Androids, and it is free with no ads. It's easy to use. It does need a Wi-Fi connection to download the app originally. However, after that, families can use the app without pulling any of their data or using any of that, which is often a concern. The interactive milestone checklist not only shows you the development and what should be reached at each age, but it also includes a photo or a video of what that milestone looked like. So if the family is not familiar with a milestone, they can see what it looks like to help better identify it in their child as they're tracking it. It also includes a space to write notes, record stats from your well child visits, and it gives you some ideas of how to prepare for those well child visits. So, really inclusive of all things a caregiver may need to really track that development, learn about that development, encourage it within their home. We have available these half sheet flyers that can be used. You can order them for free. Again, you can email me and I will have the slide. And I'll also put it in the chat that we can send to your organization, your clinic, and you can use them for community events. You can have them in your waiting room. You can hand them out at visits to really encourage families to utilize this app and track these milestones. Another resource that I try to include on our presentation is Vroom. Vroom helps caregivers elevate their child's learning during the time that they already spend together, like doing laundry or driving. It meets parents where they are through the people they already trust and the places that they already go. Vroom provides tips based on science and the idea that parents already have what it takes to be a brain builder. And so it gives them ideas and encouragement to really connect with their children through these activities. Vroom also has available on their website several different environmental resources that you can use in waiting rooms or office just to support the use of this app as well. Then I have one last resource that I want to share before passing the baton to my colleague. The Bureau of Family Health has developed region-specific resource guides with a focus on autism spectrum, family wellness, which includes social barriers to health, and general and social emotional development. You're welcome to snap a photo of the QR code or visit the website to access these guides. These are really great to have on hand. Just so if anything comes up, you know directly where to send your families to and connect them. We do review them and make sure they're updated. And so it is something that is already vetted and access or easy access for you to utilize. This concludes my portion of the presentation, and I would like to invite Dr. Robinson to move us forward.
Thank you very much, Julie. Um, I am Lenora Robinson, the Program Manager for the Family Resource Center, the statewide virtual resource center under the Bureau of Family Health. And I first just want to give you a little overview of the areas that we concentrate highly on with the Resource Center in providing services to families throughout the state of Louisiana. As you see, we have a phone number and an email, and regardless to if you call within the hours of operation or not, if you call the phone number, please leave a message because it will email us and let us know that someone is in need of some services. And one of our family resource specialists will return that call. And if needed, an assessment, and if you're a provider, then we'll get the information from you and move forward. Okay, again, with the Family Resource Center, we're the virtual resource center. We service all regions of the state. We do a great deal of working with families with special healthcare needs. And if we're allowed to, we call it, we make that phone call. And when allowed, we'll do an assessment. And from that assessment, we connect them to services and resources that will help navigate the journey of whatever the child's condition is. And like I said, we have the QR code. We work with everything from physical, mental health, all the way to insurance. We work with the early steps, the VROOM program, the CDC milestone tracking chart as well. And we kind of support uh, Julie's program with the families that we service. We make sure we offer everybody VROOM, everybody the CDC milestone tracking chart, so that they are empowered and able to advocate for their children with their primary care physicians when they see a problem or suspect a problem. And again, we service all families with special health care needs that accept our services, whether they call in or we call to them and offer that opportunity. We also make sure we address the needs of all family members, not just the children, because usually when one thing is going wrong, several things go wrong. So we make sure we make it aware that we're here for the family, whatever we can do to support them, as well as providers. We work with providers. So many times they see families that are in need of services and may not know what services they need and where they need to go from there. So they can refer to us. They either refer the family or they themselves call in, and we assist them with connecting to supporting services in the community, as well as other programs within the BFH family that already have established programs that are available to provide them services. And this is how you make a referral. Families are able to self-referral. Providers are able to refer, and you simply make a phone call to this number. This number has been in existence prior to us becoming a virtual system. We were a brick and mortar. This is the same number that existed in Children's Hospital. It is a number that has the recorder, that has the ability to email us, even if there's a message left. We also have the email address that you can directly refer, and we have the QR code that takes you to our existence in the Louisiana Department of Health manual under the Family Resource Center. And almost anybody that needs anything in the state of Louisiana is able to make this call, and we help and assist with something as simple as finding the nearest health clinic to navigating that Medicaid uh, and insurance category, whatever the case may need, especially those families that have special healthcare needs that don't really know where to go. We really do a great job of supporting them and providing them with services and resources needed to navigate their journey. And similar to Julie and other programs within our BFH, we have the regional resource guide with resources that are specific to your region, as well as those resources that are statewide resources that help navigate your healthcare need, your family's needs. And it is also located within the Louisiana Department of Health Health Guide. And you can access it as well through the QR code or the email. And this is my information as well as Julie's information. Please feel free to email me and email Julie for any of your needs, or if you need further assistance in how to set up a referral for a family member, how to set up a referral, how to establish an existence in your office. We do have flyers as well as cards for the Family Resource Center. So we are accessible. We already have um, these cards in languages, in 4 languages: Spanish, Arabic, Portuguese, English, and Arabic. I think I said that already.
Vietnamese.
So Vietnamese. Thank you. So we already are ready to help families in the state. We try to eliminate the language barrier, and we have progressed very, very far in that since we began a little bit better than 3 years ago. So if you have any questions, please feel free to send them to Julie or myself, and we will do our best to assist you in making this a resource for your office or whatever entity you exist in.
Thank you so much,
Yes.
Lenore. I just wanted to make sure that you also mentioned about the language line and having somebody in office who also speaks Spanish.
Right, we do happen to have, thank you very much, Teresa. We have acquired a Spanish speaking resource specialist, which has made our ability to address that population so much better. But even if you have a language outside of the Spanish and English, please feel free to reach out to us. We have use of the language line, and we are able to accommodate. In addition, we have the ability to text them in other languages. So we're able to make the connection regardless to what the language is. We're able to provide resources and services regardless to the region. So if you have any questions, regardless to the depth or how simple it is, if they need resources, they need resources, and we want to help make sure that they're able to reach those resources and services.
Okay, thank y'all both so very much. I think that concludes the presentation for today. I'm going to take a quick look. I don't think I saw any questions in the chat. If you do have any, you can please enter them right now in either the Q&A section or the chat. If you have any questions later, please feel free to email either Julie or Dr. Robinson directly at either of their email addresses on the screen. Also, oh, I think I see one thing. Okay. Oh, that was just a comment. Wonderful. So also, if you are interested in contact hours or credit hours, Please make sure to fill out the survey that's going to pop up at the end of this webinar. Can you drop the links for the resources into the chat? Okay. Julie, we had one request to drop the oh, you saw it? Okay, perfect. Yeah, we'll wait a couple seconds so that Julie's able to drop the resource link in there. And again, if you have any questions, please feel free to add those. And there we go. Please make sure to fill out it's a very short survey just to let us know how you're doing, and we will get you your certificates at the conclusion of the series. It's just those two to send, Julie. Okay, awesome. All right, well, thank you all so very much, and I hope to see y'all next week for our next webinar. Thank you so much. Have a wonderful day.